This is one of the biggest limitations a dentist can impose on themselves. Bruxism is part of TMD. It's not my specialty. I'm a general practitioner. I have a different specialty. I say this with total respect for your background and your training. And for TMD as well, because in reality, you weren't trained to be a comprehensive clinician. You were trained to be a technician to solve specific problems. But I need you to understand once and for all that dentistry has changed. Stop looking at the tooth, the jaw, the bone in isolation. Rarely were you encouraged to look at the patient in a functional, broad, and connected way. And that's why it's natural for you to think, bruxism, that's a TMD thing. That's not my area. I don't want to get involved in that story. But let me show you, bruxism is present in every dental specialty, and ignoring bruxism will lead to invisible technical errors. For example, you make beautiful ceramic veneers, resin restorations, or facings, but then the veneer cracks, the resin breaks. It was the active nighttime bruxism that wasn't diagnosed. You deliver a rehabilitation, a perfect, well-adapted result, but the patient starts reporting a strange sensation, a fracture, or unexpected wear. The mistake here isn't technical. It's not having controlled the bruxism, which acts as an amplifier of problems. The implant became unscrewed. So what do? Do you lose the prosthesis? It's a hidden clinical error. Didn't control the functional overload caused by bruxism. You're going to have a problem. Take orthodontics, for example. You do an impeccable treatment with a great finish. The patient has an early relapse. Without control, there's no aligner, no retainer, nothing that can support this patient. Endo, for example, the lesion is regressing. Everything is fine within the standards, but the patient still has pain. They might be bruxing all the time, which then causes this pain. So the truth is that bruxism isn't a specialty, but it is the clinical foundation. It's present in every specialty. It cuts across all areas. And if you don't include this in your differential diagnosis, you're failing to properly care for your patient. You're missing out on a lot of revenue with a lot of integrity in your clinic, and you're missing the chance to establish authority with your patient. You'll lose patients, you'll lose referrals because your patient might not see you as a true authority. If you want to know more about this topic, like and share this video with more dentists.